paper in yoga and physiotherapy. Now, physiotherapy is a very, very vast subject. We help in orthopedic problems, neurological problems, gynec problems, even skin problems, dental problem. During dental problem, they have this temporomandibular joint pain, this pain, there is a joint here. So we help in pain in many, many conditions. Now, today we'll talk about flexibility. Okay. Anybody can give throw light on what is flexibility? Okay. Flexibility of a joint. As a physiotherapist, flexibility of a joint is a full range of motion without any discomfort or pain. Okay. The flexibility of a person varies from male to female, from age group to age group, from child to elderly, from sports person to a dancer. Now, what are the advantages of having a flexible joint or a flexible body? Then you will get more attracted to do exercise and make your body more flexible. If your body is flexible, then every day, whatever aches and pains, whatever injuries you get, small injuries, that if your body is flexible, then you can avoid those injuries. If at all you have got injured, then your recovery is also much faster. If your body is flexible, you feel very light, your muscles feel light and relaxed. You don't feel your own body weight. It looks very, very graceful also if the body is flexible. It looks very lithe and flexible and graceful. If your body, your joints are flexible, then your balance is better. Because as we advance in age, if you suddenly get up from a sitting position and start walking, you are not that confident. You can lose balance. Suddenly, if you are just standing and turn, even only your head also, if you turn, you can feel little imbalance. So if your body is flexible, your balance is going to be much better, which will help you from falls. If you are flexible, then the strengthening of the muscle also becomes easier. If you are flexible, then your confidence level also is better, looks also better. The stiff body, you must have seen somebody, with a stiff spine. It looks like a bamboo. Looks wise also flexible body looks very graceful and lachila, बोलते हैं ना हिंदी में, लचीलापन लगता है. And you will feel very, very light. If at all the body is stiff, then you are more prone to injuries. Even small injuries will give you lots of aches and pains. If you are not flexible, if your body is stiff, then you will feel your own body weight also much more than what it is. There are all types of flexibility exercises, and it's very important you do it. Flexibility exercises are mainly 3 exercises. It is called static flexibility, dynamic, and PNF technique. We'll take up first the static flexibility exercises. What is static flexibility exercise? What is muscle first? Muscle is an elastic tissue. See, it's like this. Okay, this is elastic. Muscle is like an elastic tissue. If we stretch it, the muscle, if it is stretched, it will get stretched. But if you stretch it beyond, certain muscle fibers can break, certain muscle fibers can get overstretched, they will pain, they can even get torn from their attachment. So it's very important to do stretching exercise, but within limits. And how to find the limit? Whenever you are doing stretching exercises, it should be within pain-free and comfortable stretching. It should not give you too much pain also, and it should be comfortable. And the holding part is very important. Once you stretch the muscle, you hold it for the count of 8, minimum 8. And 8 should not be counted very fast or not very slow also. In static flexibility exercise, you are stretching the muscle, but there is not much movement of the joint. Okay, and you are holding that stretch for the count of 8, minimum 8. And once you have exercised for a few years, then you can slowly increase more than 8, 9, 10, 12, like that. And what is dynamic stretching of a flexibility exercise? Where there is movement of the joint and the muscle is stretched. It's like a pendulum exercise. But in pendulum, it moves only in certain direction and angle. Here, it is going to be like, much more bigger movements, much more bigger. You have to just throw your arm. If you're doing for your shoulder, you are just literally going to throw your shoulder, arm. You are going to just, and few fast movements. And PNF technique, proprioceptive neuromuscular facilitation. That is called P for Paris, N for Netherlands, and F for France. That has to be done along with a physiotherapist. Physiotherapist will be guiding you, and you will be doing exercise in conjunction with her support. So PNF technique has to be done with the physiotherapist. But static and dynamic exercise, you can do it on your own. Now, there are, when a child is born, there are 270 bones are there. As he advances in age, certain bones are fused. So then there are 206 bones in the adult body. And there are 370 joints. Why there are so many joints and less number of bones? Because how the joint is formed? The joint is formed with 2 bones, minimum 2 bones. More also are there, but minimum 2 bones. So when the 2 bones meet, they have to be held in position with the support of muscles, tendons, ligaments, cartilage, synovial membrane, and this is all called soft tissue. You must have heard, doctor saying, oh, fracture nahi hai, khali soft tissue injury hai. Means there is injury to muscles, maybe to ligament, cartilage, or synovial membrane. So it is held in position with the help of all this soft tissue, mainly muscle. So it's very important we have to strengthen the muscle and all these soft tissues, because then the joint will be held in position. Otherwise, it will get dislocated. Doctor bolte hai na satak gaya. Sometimes they say, shoulder joint satak gaya. It gets dislocated from its position, maybe forward, backward, or sideways. So it is very important to do these exercises, stretching exercise, warming up exercise, and strengthening exercise, and keep all the muscles around the joint strong. Now, there are some movable joints, there are certain immovable joints, and there are certain partially movable joints. In the skull, the bones are absolutely immovable. Their joints are immovable joints. In the sternum and ribs, they are partially movable joints. When we take a long, deep breath, the sternum and the ribs will be moving slightly, partially. And all other joints, even in the hand, even in the foot, they all are movable joints. And there are many, many types of joints. Each bone is different from the other. Except, left hand and right hand is different. Otherwise, everywhere the shape is different, their function is different. And all the bones are hollow from inside, from where they get their nutrients. That's another topic. So now we'll come talk about the joints. Ball and socket joint. See, this is the ball and this is the socket, okay? And the joint moves like this, like a shoulder joint. It is a ball and socket joint, okay? This is the arm, this is called humerus, and this is the socket of the scapula. Okay, this is ball and socket joint. Here, in ball and socket joint, the movements are maximum. It can go forward, my arm can move forward, backwards, sideways, and it can rotate clockwise and anti-clockwise. Same way the hip joint, which is the biggest joint in the body. And it is a weight-bearing joint, because as soon as you're out of your chair, out of your bed, you're on your feet, it takes your own body weight. So it's called a weight-bearing joint. And it has also got many, many functions. Like elbow joint is a hinge joint. There is one bone, top is humerus, and there are two bones in the forearm. So the movement is just this. Whatever rotation is taking place, it's taking place among these two bones. Even the knee joint. Knee joint is made up of 5 bones. One, the top from the thigh. Then one is the small, that round shape, patella, if you know the name, the patella, vati bolte hain. And there are 2 bones in the lower leg. And it is a weight-bearing joint. It's a very complex joint, and you have to strengthen खास करके quadriceps and all the muscles around the knee joint, because they are going to support the joint. Like somebody asked me a question that somebody has undergone knee replacement. Okay, doctor has done his job very well. Okay, you have also spent time, money, energy, everything. But now physiotherapy and exercise you have to do to strengthen the muscles. Because देखो भगवान ने दिया हुआ भी joint घिस जाता है over a period with aging or maybe premature or maybe because of some injury. So now when it is replaced with the best of the doctor and the best of the prosthesis, you have to do exercise and strengthen, make the muscle stronger than even what it was. And once you have learned just 2 to 3 days of exercise from a qualified physiotherapist, you will be able to do it on your own. It's very important. Now, when the child is born, if he starts exercising or he starts playing some games, sports or dancing, then his flexibility will be very, very good. If at all, middle-aged, somebody has never exercised, he or she wants to start with exercise, with flexibility first, warming up, stretching, and then strengthening. But very, very gradually. You have to, body always gives you signal. You have to learn to accept and know those signals. Not to overdo also. It's a very thin line. And exercise is a lifelong process. Don't get worked up कि भाई आज का आज चालू किया. No, it's a lifelong process. So you have to do it. So don't be in a hurry and just train yourself. Start very, very gradually. Have a lot of patience. And then do it minimum 4 to 5 days in a week. And minimum 20 to 25 minutes per session. You can't do it just Saturday, Sunday. No. And please don't do any flexibility exercise, any exercise with the weights when you are mentally stressed or you are in a hurry. Oh, I have to just do my exercise in 10 minutes and I have to meet my friend. No. If you're tense or if you're in a hurry, please don't do exercise, because you are going to strain your muscles. Avoid doing exercise when you are stressed. I always advise all my patients. I am also a grandmother. I do my exercise in front of my granddaughter. I will not tell her to do exercise. I will not even tell my husband also to do exercise, but I will do exercise in the hall where everybody, even my servants also can watch and let them get inspired. My granddaughter will imitate me. And it's so much fun to do exercise in a group. Now, what are these flexibility exercises? Okay, these exercises, I mean, in India, we have yogasan, which is time and again, it's a proven thing. In yogasans, they have given names like Tadasan, like you stand tall like a tad tree. Okay, Parvatasan also they call it Tadasan, Trikonasan, Shalabhasan. All yogasans are mainly flexibility exercises. It increases your flexibility and in turn, you will tone up the muscles. In physiotherapy, in medicals, we have given names like flexion, extension, rotation, abduction. In yogasans, they have given names according to the pose. So it's easier to remember, like a cat pose, like a camel pose, like a dhanurasan, you know. Yoga is very, very good to increase your flexibility, but start very, very gradually. If you are a senior citizen, then I would advise at least 2 to 3 sittings you take with your physiotherapist, understand, and then you start and continue it. Even Tai Chi. Tai Chi is a Chinese form of doing exercise. That is also very, very good. It's a very slow form of exercise where you don't strain your joint. Joint means mainly muscles, ligaments, and cartilage. And is always done in open air with a group of people. So it is much more fun. Like our Surya Namaskar. If it is done in front of Surya, you get even vitamin D also. Surya Namaskar is a combination of many asanas. Once you learn these asanas separately, then it is done. Surya Namaskar is learned, combining everything. And if it is done fast, Surya Namaskar is very good for your heart also because it becomes a cardiovascular exercise. These all stretching exercises has to be done. I mean, all exercises, preferably not absolutely empty stomach, but definitely not 2 hours after your, only 2 hours after your meals. You can do your exercise and have your breakfast, but don't do exercise and immediately you have your heavy meal. It has to be done regularly and preferably if you are a senior citizen, take little advice from a physiotherapist and then start gradually. You must have heard of, stiff joints of the fingers. Rheumatoid arthritis is called. Exercise is the only, especially stretching, flexibility exercise. And you can touch your toes, means you are flexible. No, it's a wrong thinking. I can touch my toes, so I'm flexible. No, all the joints, even the smallest joint also has to be flexible. All the joints has to be flexible. It's not just I can touch my toes, so I am flexible. All joint has to be flexible. Because if the joints are not flexible, it will be like a bamboo, your spine, your action. If I have a frozen shoulder, if I have pain in my shoulder, if the food is laid on the table, if I have to help myself, I cannot stretch my arm. I have to stretch my whole body and pick up. Or I have to get up, help myself, and then sit down and eat. So it's not just flexibility, is not just only I can touch my toes, I am flexible. No, your shoulder, your neck, your foot muscles, because the arches, because as you advance in age, your arches become flat, and that will put more strain on your knees, especially ladies. You know, we Indian ladies we are little more broad from the bottom. So all the weight goes on the foot and the arches become flat. And the foot also changes shape, which causes many aches and pains, and in turn the foot, if you understand the architect of the mechanism, architect of the body. So it's very important to do exercise even for your foot. Massage is good, but from a proper known person who knows the massage. Otherwise, exercise, flexibility, stretching, warming up, and gradually strengthening is the best form of exercise. It's the way to go. I think now we'll take up questions. Anything else you want to know? We'll take up questions.
Yes.
I'll see the chat box.
Yeah, I'll dictate the questions to you. So, ma'am, Sunita ma'am has asked, I get cramps in my thighs frequently. What should I do?
Yes. See, when you get a cramp, don't do anything. Just relax. Don't try to press it. Don't try to bang your leg. Nothing. That time, just relax. But how to avoid the cramp? You have to take a lot of water. You have to take nariyal pani, calcium, and magnesium and potassium. We just talk of just calcium all the time. Yes, that is most important. I agree. But even magnesium and potassium is also, I would say, equally important. So वो आपको मिलेगा नारियल पानी से. And what did I say? Nariyal pani and banana. But yes, everyday banana can again make you gain weight. So you decide, make it alternate days with nariyal pani or alternate days with banana. And exercise is very important. Exercise is very important. Take it, make exercise as a routine. How from young age you are doing, brushing your teeth. You take shower every day, maybe once in a day, twice in a day. You take hair bath almost every alternate day. Like that, even exercise also try and incorporate in your routine. Like we don't count, 10 minutes for my bath, or 3 minutes for my brushing my teeth, or 10 minutes for my washing my hair. No, we never count only. Like that, you incorporate exercise, flexibility exercise in your routine, and you will see, you will feel your body so much lighter. You will feel so much better. Your confidence level will be so much better. Okay. So try it with this nariyal pani and banana. And when you get a cramp, just relax. You can't do anything that time. And exercise is the most important. Okay, yes. Next, please.
Yes. Also, just a note to all the learners, if you all have any questions, please put it in the chat box right now. Or if not, then please raise your hands. Once we finish all the questions from the chat box, we'll take up your questions. So the next question is from Shobha ma'am. She says she has osteoporosis and she's 70-year-old. So what would you suggest for that?
Yeah, Shobha. This is a very common problem, especially more in nowadays you are seeing in male also, but females, because our hormones, our whatever delivery 1 or 2 or 3, whatever you have undergone, so that also you are losing calcium. So you have to be taking calcium and vitamin D orally. That is definitely, it is there. And exercise, and mainly weight bearing exercise. उसमें आप lying down में exercise योगा करेंगे लेट के या बैठ के, वो इतना नहीं help करेगा. You will have to stand up and do the exercise. weight bearing exercise, and with the weights, resistance, you understand? Any exercise, taking dumbbell in your hand or tying a weight band on your foot or on your wrist against weight, which will again make you absorb the calcium, whatever you are having in your daily routine. And for osteoporosis, early morning sun rays. Just strip as much as you can and sit under the sun or exercise under the sun. It is very important. And as you advance in age, try to reduce weight, which is difficult. But even if you can't reduce, try to see you maintain weight. You don't increase every year half a kilo, 1 kilo, half a kilo, 1 kilo.
Okay.
Try to maintain. Reducing is difficult, I understand. But try to maintain. Yes.
Yeah.
Next, please.
Yeah. So Rashmi ma'am is saying that she has numbness in her fingers at night while sleeping. So
Yeah.
what can we consider that?
Again, exercise. And if you are a very tense person, sometimes, you tend to tighten your fist, clench your jaws, teeth. So learn to relax, meditate before going to bed. Just relax your mind, relax your body, physically, mentally, because mind and muscle has got a direct connection. If you are tense, if you are worried about the next day, next morning, then your muscles will go into tightness. They will get tight, the circulation will reduce, and you will feel numb. And do all stretching exercise. Your wrist, absolutely stretching both ways, both the sides, and hold it for the count of 8 and relax completely. You have to give it relaxation. Again, stretch it, hold it for the count of 8 and relax completely. It's very important. Sorry. It's very important. Learn to relax with your mind, your muscles, and do all stretching exercise. Even you can do like spring action also, slight spring action.
Oh, ma'am, there is some noise from your end.
Sorry?
There is from your end because of the phone, maybe.
I can't hear you.
There is some disturbance from your end because of the phone that just...
The phone is cut.
Now it's fine, Yashvi. I can't hear any disturbance. It's okay.
Yeah.
Sorry.
Now, yes.
Yeah.
Sorry. Okay. So yeah. So now, the next question is, what is the difference between acupuncture and acupressure, and what is better according to you?
Yes. See, acupuncture is with the needles. Okay. It both are Chinese, but acupuncture is more accurate because it is with the needle and the proper point is given. And acupuncture, only people can learn those who know the basic anatomy. Like a medical or a paramedical people, those who have learned anatomy. Acupressure is also good. There is no harm if a person knows about it, because not much harm can be done. If you are going to get benefited, fine, but you are not going to get harm. But acupuncture has to be done from a proper qualified person with a disposable needle. With a disposable needle. Even for your own body, once it is used, it has to be discarded. Acupuncture is definitely more, accurate, more helpful, but it should be done with a proper person. Because in India, I know so many people, they don't know basic anatomy and they are doing it. And sometimes they are reusing the needle. They just use again and again. So that way it is very, very harmful and dangerous.
Okay.